So thank you very much to our resource speakers and presenters. We will entertain your questions. Are there any questions? How long do these excreted SARS-CoV virus persist in the water? So maybe Ms. Otero and others.
Yes, ma'am. Thank you for the question. The question is, how long do these excreted SARS-CoV-2 persist in the water? We do not have first-hand data about that, but there are papers from other countries, although those are temperate countries, and those that their information may not apply to a tropical country like the Philippines. So I would like to stay on the safe side and say that there are no studies yet that can answer that, but that's also an important thing that we have to consider. So that will also have a bearing on how much RNA we can recover from the water. I think, Ma'am Caro, that will relate also to the residence time, right? If you would like to add something about that, po.
Yes, so one of the considerations for the physico-chem and the recovery of the genes, SARS-CoV-2 genes, is whether these waters have remained there for a long time. Are these young waters? Are these old waters? Is the organic matter preserved or not? Are they degraded? This would all impact the amount of SARS-CoV-2 genes that could be harvested from those waters. So those, like I said, researchers out there's so much we still need to learn. Along with other countries, we are all struggling on this. And what's really good with our Philippine research team for WBE for SARS-CoV-2 is that we're considering all this physico-chem, residence times, discharge, volumes. So we are considering this in connecting the amount of recovery of viral RNA. In some of the papers that we've read, these are not considered, but we know and we've seen from our data sets that there are effects, especially because we're not collecting from wastewater treatment plants, and the wastewater samples that we're collecting is exposed to the environment. So we need to address the bias on the effect of the environment before we can explain the amount of viral load RNA that we're getting. So maybe
yes, but maybe I can proceed to the next question, po, Ma'am Caro. So the next question was, how high or low is the possibility that these excreted SARS-CoV virus reinfect residents nearby? I think there's a paper on this where they focused on workers in a specific wastewater treatment plant. So you can already imagine that the virus there, if there's an outbreak in the community, it's very concentrated in that WWTP. But what they saw was there was no difference in the risk of infection of those who are working in the WWTP compared to the general population. And there are also early studies saying that the SARS-CoV-2 that we excrete from feces are actually not infectious anymore. They are dead. No, they are not infectious, but they still can be detected because we're looking at RNA, and the RNA in the virus can be preserved. No, that's why we can be able to detect them. But in terms of infectivity, there have been many studies that have shown that they are not infectious anymore. No, once they are shed in the feces. So there is the general danger to the general population. I think that would not be so much of an issue when we're looking at COVID-19 or SARS-CoV-2 in wastewater. It's more of the application of SARS-CoV-2 surveillance in support of directing public health interventions. For example, looking at areas where there's a brewing or increasing community transmission, that could be one of the applications. So we do not also want to be fearmongers or saying that you might be infected, because there is no data that supports that in the recent literatures. So there's another. And the 4 parts of the question is a long question. So the last part, were these mutated SARS-CoV in the like of the Alpha or Delta, and which we were unable to capture in genome sequencing? Unfortunately for WGS, although we did have success, our success was actually not that big. It's not comparable to what we are already doing in clinical surveillance. Because of the general nature of wastewater, it's a very difficult matrix, and we were having difficulty getting enough genome coverage from our samples. We're trying to work on that. We try to increase the genome coverage so that we can have more genomes represented in our WGS data. But what we did see are SNPs that are contributing to some of the earlier variants, because we did the WGS in 2020 pa po. So far in 2021 and 2022, we do not have WGS data yet, but we are scheduled to do the wet lab and the dry lab for the 2021 data when we go back to Davao next week. Actually, we've already scheduled this with PGC. So I think when that run is finished and when we can write our partial results about that, then we can provide more information about these questions po on the SARS-CoV-2 variants, because we're looking at SNPs lang po. And as we understand, the variants, they have this collection of different single nucleotide polymorphisms that are able to give them that specific trait as a variant. So as of now, from wastewater, we do not have that type of data yet, but we are working closely with Philippine Genome Center to be able to provide more information from the wastewater. So thank you for the interest.
May I also add, yes, I agree, the water samples that are exposed in the environment are very, very complex. On the bulk, it has urban wastewaters, industrial wastewater. So really it affects the type of recovery we have for our viral RNA. Thank you.
So maybe we can continue, Dr. Jaraula, with the next question. What are the implications of having found SARS-CoV-2 RNA in wastewater? Does this mean that there is a possibility of an outbreak, or does it indicate severity? So we do not have information on severity because we can only detect whether there is how much viral copies are there in the in the wastewater, from the RNA data. So what we can say is that when there is increasing RNA titers that we are getting from the wastewater, it's likely that the community where we got that sample from also have many individuals having an active or possibly transmitting the SARS-CoV-2, the COVID-19 infection to their households or to their neighborhood. So that's the information that we can get from wastewater surveillance in the communities. About the identified mutations not recorded in clinical surveillance. So of course, we know that the biosurveillance team is doing regular WGS data, generating WGS data from many clinical samples representing different regions in the Philippines. So they have a very wide collection of clinical samples that they already tested. So what we mean when we said we were able to get SNPs that are reported earlier in WBE, it means it's already circulating in the communities, but the sample that biosurveillance was able to provide because they are doing it in random. They are not testing they're not testing everyone, because they do it on random. The chances or that we were able to pick up the SNPs or the mutations earlier in wastewater because we're working with pooled samples, then comparing that with random sampling of individual cases. So I think that's the more on the ability of WDB to work on pooled samples, getting many people in one sample, testing effectively, say hundreds or say tens and hundreds of people from one sample, comparing to individual individual cases that are actually being done by surveillance. So yun lang po. Actually the biosurveillance team, they're using a more advanced WGS, because they're using I think they're using Illumina platform, but here for the WGS team in iWas, we were using nanopore MinION, and there are already differences between the two platforms. So that's another topic that we can actually talk to PGC about. But in terms of our data, yun po, nauna namin na-pick up kasi pooled po yung sample namin. So yun po yung implication.
Let me also add, so detecting the abundances of this viral RNA, it could help in terms of local government forecasting of what barangays may need or developing risk for that barangay, rather than a blanket shutdown or lockdown, we could like look in the map, where are these barangays that are more at risk? Is the population there transient, or are they there as a residential, or is it like more like a mall type of population, they're transients? So we could use this along with spatial data, temporal data. We need to study the trends, and along with the dashboard, the applications that they've developed, probably use this as a tool, as a science-based tool to decide on which barangays are more susceptible.
Okay, so another question po, Ma'am Cara, if I can read po. How replicable are the other techniques po in other areas in the country? Actually, this is an interesting question po. We've talked about this yesterday when we were planning this talk, and we want to really steer the focus no and being able to provide or to be able to make sewer shed maps, because the technology per se is the same as what the technologies done in other molecular based studies or diagnostics. For example, in the COVID labs, as I've mentioned earlier, we were using the same kit, no, the same commercial kits, and we can also do this na yung in-house na validated na kits, and we were using the pipelines that are also common. So the technique there is really very similar and can be done in any molecular biology laboratory. But I think the focus there is, if you want to work with COVID-19 surveillance, it has to be biosafety level 2 po. No, kasi yun po ang recommendation ng DOH. So UPMIN also had to also be compliant with that before working with SARS-CoV-2 in wastewater. But in terms of being able to replicate the methods, we were also using the methods from abroad, no, the published papers, and we were also only tweaking a little bit to be able to fit to our laboratories. As with other methods, there really has to be a little bit of in-house validation, but generally po, the workflow is very, very similar po. So I think there should be no trouble in big laboratories that already have molecular biology workflows. There will be lesser preparation po siguro for them to be able to implement what we did for SARS-CoV-2 WBE in Davao City. Welcome po. We have also another question po from Sir Kizon from UP Manila. Hello po, sir. Good afternoon po. Did you analyze treated wastewater samples? So if yes, were there still traces of the SARS-CoV-2? Sir, one of our assumptions po is because of the high level of fecal coliform that we are getting partially treated wastewater. So Ma'am Cara can also maybe add to this po. But we were getting samples po from the culverts, no, before they reach the rivers. So our assumption po based on our fecal coliform data is these are either untreated or partially treated po. So Ma'am Cara, would you like to add some more po about this?
Yes, I also remember we have a set of samples from a certain industry that's really very clean, and we did not expect that. So we attributed that to their wastewater treatment. So yes, we think we've looked into samples that were treated, and of course, there's also effect on the amount of recovery of viral RNA. So even if there's wastewater treatment plant, you need to identify which part of the plant you're collecting samples. So whether it's the influent, very raw, very fresh samples from domestic wastewater, or those that are already in the middle part where there's some treatment, or those that has been released. There could be differences there.
Yes, but if I can just add po, I think this is important when looking at AMR po, because some of the ARGs, even when they go through the wastewater treatment facility, some of them are not removed efficiently. So I think that's also one application of looking at treated wastewater. But for the purpose of the study po, we're looking at, ayun po, ang aming assumptions is they are partially or untreated or partially treated wastewater, but that we were able to get from our culverts.
May I also call in Ms. Mariano? She has some data set about implications of wastewater treatment with pharmaceutical and personal care products.
Ayan po, sige po.
From our study in a USAID project, we sampled a private and a public hospital, one of which did not have their treatment when we sampled. So remember, in the results, we detected caffeine and acetaminophen for sites, which indicates untreated wastewater. So in the two samples from the hospitals, the treated wastewater did not, we didn't detect caffeine and acetaminophen as much compared to the other hospital that did not have a treatment. So, but certain antibiotics and pharmaceuticals can still persist even after treatment, and this could also this can also happen with the other markers that are being studied.
Yes, may I also add that a lot of times the treatment, wastewater treatment does not target antibiotics and other pharmaceutical products. So there could still be there could still be residues even after treatment. In some places where they have adopted treatment for these pharmaceutical residues, it could increase the amount of, the concessionaire could increase the amount of payment for our water bills because it will entail really targeted cleanup of these pharmaceuticals. So in most places around the world, the pharmaceuticals passing that are treated may have been accidental with the current treatment plant. But if you really want to get rid, we can still get rid of it, but it could entail several processes downstream of the cleanup. Thank you.
Ma'am, for the next question po, maybe we can ask Fem to answer this question from Sir Lance about the sample collection dates po. Maybe Fem, you can answer this question for us. Basahan ko, Fem, for you. So during the sample collection dates, did the project team update or check the wastewater routes if they are still the same? So given that these can be applied to forecast barangays, there may be some roadworks or drainage projects which would affect the routing of this gray water, which can also have an effect on the forecasting. So yun po ang tanong. Fem?
Sorry po, ano po yung question? Hindi ko po makita kasi dito.
Ay, sige, I'll read it again. During the sample collection dates, did the project team update or check the wastewater routes if they are still the same? Because there might be some roadworks or changes in the drainage which could affect our sample collection.
Okay, so actually our sample collection range for a year, and yung sampling site po namin is nadadaanan namin every time we go downtown from UP Mindanao. So we can actually see that the drainage networks are still the same, and we were lucky enough that the construction of drainage networks were actually done prior to our sampling. So updated na po yung sewer shed map namin once we did the sewer tracing activities. So ayun po. Thank you.
May I add to that? So in some countries where they have sewer networks that has pumps if you have excess of water, for example, during a storm. So a storm drain could have a different signal from just a sewer pipe. So they also have, even with those technologies, they also have challenges like during storms, the pumps would divert the waters, and then this will also change the recovery of viral RNA. So whether we're dealing with natural systems like just the rainfall the previous night, or advanced engineered systems where the sewer networks have several pumps. So we're all in the same boat. This changes from time to time, and that's why we need to have a normalizing factor to attribute the abundance of viral RNA to what's happening in the environment.
Yes, po. So we have another question po from Business Mirror. I think Ma'am Dann can answer this one, Dr. Del Mundo. We have a question po, Ma'am Dann. Were the findings related to the city government? What was its initial reaction, or what were the initial actions done?
Oh, yes. Actually, we are in close coordination with the city government, and we also submitted our published data to them. And we have intimate connection with specifically with Barangay Mintal, because that's our main area for our phase one, and they are very supportive of our activities, and even they said that, okay, we will help, because remember, as we've said, the clinical data will just be based on the big barangay, but our sampling site is Torok, or just a small portion of the barangay. So they said that they will help us coordinate to give data on a specific case on a certain barangay. And also in terms of like the waste watershed, right? The sewer shed, you have coordination with the city engineering office. So you may elaborate on that.
For the findings on the sewer shed maps, we also submitted a copy of our publications to the CPDO and CEO, City Planning and Development Office, as well as City Engineers Office. And soon we'll be coordinating with them to provide them a soft copy of the sewer lines that we traced in Barangay Matima Crossing. As well as we have also connected with them recently last September, I think, for an updated drainage sewer networks from their end naman po. So that's it. We're just collaborating with their offices, and we're actually also reaching out to DPWH in order to see the sewer networks in national highways. Thank you.
Yeah, if I can also add that to that po. One of our speaking engagements last year, we were fortunate to have DOH Region 11. So the RESU po, Region 11, and they heard us talk about wastewater-based epidemiology, and they were actually trying to we're trying to set up a meeting with them because they're interested in asking for our help, so that we can help expand the environmental surveillance for the region. Since as I remember, there are only limited samples that can be tested by the DOH coming from the region. So if we can complement, or maybe we can do more we can test the new samples, additional samples, and I think that will be able to produce more data for the region. So we're exploring such collaborations and working together closely with the government, because as we have said earlier po, we also want that what we do will also be supporting what the DOH, the regions, and the national and the city are already doing, because yun ang pareho naman po tayo ng goal. So hopefully we will be able to give more information about that in the next months or the next weeks po. Yes, we have two more questions po. So one from Ma'am Krisha of Inquirer. Should local governments start using WBE to check vulnerabilities of communities, or how often should they do testing? So WBE, should local governments be using WBE already? So I think given that there's a lot to do for WBE, but weighing the benefits of being able to really at least start or initiate the WBE preparations, I think it will help a lot for future public health surveillance. But based on our experience, if we can get partners who are able to also help us replicate our hands and feet so that we can do more faster, I think we can WBE could be easier implemented in other cities. Hindi lang po sa Davao City, they are also beginning it here in, I think one in Visayas also here, and here in Manila, and there in Manila, I mean. So the more people who are doing it, the more we share our information, then the faster we can have this up and running, and it will be able to also give information about the vulnerabilities of communities in terms of water-related diseases. So how often should they do testing? Since surveillance po siya ang target, kailangan po talaga systematic and periodic siya. So that's why I think it's better if it's done regularly. Usually po, every 2 weeks, kapag nasa ibang countries po, ang surveillance nila is every 2 weeks, they get samples from the environment or from wastewater and test it every 2 weeks. But for us, we did it every month lang po. Yun lang po kinaya ng budget. But if we can have more data points, then we can have more data also that we can say that can help us estimate the vulnerabilities of communities to specific or targeted infectious diseases. Yun po. Anyone who wants to add po from our side?
Yes, I'd like to add an answer to that. I think it's the framework of wastewater-based epidemiology is very important. It could be, it's not too complex. There are several facets of that. We could start with the easier ones. Having that framework in, it can work for many types of diseases. SARS-CoV-2 is just one of them, but it could work for others as well. So having that framework in there would be good for all local governments. It's necessary to have their own for each local government because it's very different from one to the next. The natural environment is different. Some are more agricultural, some are more urban. The sewer networks could be different, could be engineered or it's not. The population density is different, land use is different. So it would be good to have that for each local government. So we can just start slow, standardize all. That's why we're really inviting everyone. If you're interested, there's a big part of the Philippines we could do this. This is just a pilot study, and we could also learn from your sites. We've only looked at a small part, a specialized part, urban, upstream and downstream in different areas of the Philippines, like tourist areas. There could be very different scenarios there, and there's still a lot to learn. And I think other countries can also learn from us as well. Thank you.
Thank you po. We have a question po from Ma'am Altura of UP Manila. Ma'am Caro, kayo na po siguro ang pwede mag-answer dito, ma'am. The question is about sampling po. How far from the coast did you get your samples? How deep? And how many sampling per site po? I think this has a bearing on our pilot data din, ma'am. Remember po yung ating isang barangay sa 23C na malapit po sa coast. Maybe we can share that one po, Ma'am Caro.
Yes, so we have this difference between wastewaters are usually freshwater, and then we go to the coast, depending on the tides, we could have saltwater or brackish. So just the matrix of the water itself are very different, and the number of population at that time in Davao, when we were sampling, there was a lot on the coast. Right now, the last time I visited, the whole community is not there anymore. So in terms of the physical chem, they're very different. And this would have an effect on the matrix and how we're able to retrieve the viral RNA. So at some point, we're just starting with the study. We just wanted to look at this contrasting scenarios: freshwater, brackish, saltwater, population, residence time. There were stagnant waters where we recovered high viral RNA, but we're not quite sure that water is quite old as well. And because the dissolved oxygen level is very low, so there's less degradation through oxidative degradation. So there are several considerations there. Yes, we sampled very close to the coast, but we did not get a good viral number. Was that the situation? And it's quite difficult to compare it also with other freshwater samples. So on the next phase of our study, we decided we'll just stick with freshwater samples. It's easier to compare.
Yes po, correct po yun, Ma'am Caro. Medyo mahirap po ako pag nag-mix na tayo because it's gonna dilute our viral virions that are in the water, and two, it can also degrade, so that's why degrade our RNA. So may effect na naman po siya sa RNA recovery. My follow-up question po about that. In concentrating the wastewater sample, it would be turbid. How many manifold filter funnels did you use for 100 ml sample? I'd like to share we used two methods for concentration. Different po yung sa pilot. We used PEG NaCl as a protocol. Medyo technical na po tayo ng konti. So, I had to just add a little bit of details. But for concentration po, kasi meron po kaming sites, for example, in one of the highly populous barangays, the wastewater is actually very oily na po siya, no? Hindi lang po siya basta turbid, oily po talaga siya. So I think for that part of the pilot, the method that we used was not yet using the manifold and the system. Actually, we used Promega po. So I think it worked well with the PEG and ACL protocol. And then we filtered it with membrane filter na lang po afterwards. So, kasi po, merong mga kits din ngayon available that they already give you the column. Ito po, naka-manifold na po kami. So, I think you'll also have to consider po your sample, the characteristics of your sample. If it's oily, if it's turbid, it's better po if you can spin down kung meron pong sediments kasi babara yung ating column niyan. And for our volumes naman po, recommended by the kit was 40 ml. But since we're getting very low signals, we're planning to increase po say 80 or twice or 3 times the volume and pass it through the same column just so we can get more samples po using the same column. So those kinds of tweaks po, we really have to consider the type of sample that we are working with so that we can adjust as needed. Thank you po. I think those are the last questions ata, Ma'am Caro from the group. Thank you very much po for your questions and your interest po for WBE and what iWas has been doing for the past 2 years.
Hi, good afternoon, everyone. And congratulations to the presenters. Like, this is amazing. This is the first time I've been working with this surveillance over 15 years right now. This is the first time we heard of this kind of surveillance. No? So congratulations. No? So just a brief comment on, I think post-pandemic, this is not the game now is early detection. Early detections of a possible cause of an outbreak. So it doesn't really matter if you are not able to detect or correlate it to the clinical case in your studies that were conducted. The most amazing part is that we were able to detect a viral RNA in an area without any cases. Because that's actually our problem right now. No? So I think that's really amazing. That's the most important part. I think that's the best, the product of your study. So again, in the challenge in doing this kind of surveillance is actually the mapping of the sewage system. So that's really another amazing thing that happened. So, for example, in Quezon City, how are we going to do a mapping of a sewage system? So we'll be able to conduct a wastewater surveillance. So that's actually a very big questions right now in my mind, no? Because the absence of really a very systematic sewage system in our city. So I think this is going to be also a problem in other cities. So we have a very antiquated wastewater system. So my question is, what will be the next step for your project and how is it going to be done? Will you do because you already sampled only in a couple of barangays, no? So what about the most important part of surveillance is that we're able to have at least sentinel sites for one city, for example. So you have sentinel sites for one city so that you can collect systematically and analyze systematically. And therefore you will be able to analyze, it will be, for example, if you find any RNA measles or polio in that sample, that will be the first time for our country right now that we don't have a reported polio case, but we're able to detect it in a wild polio in our sewage system. So those are the things that are actually playing on my head. No? So what will be your next step for doing this? So, because I think the next game for the Philippines to be ready is to have a very modern and systematic surveillance system that should include a wastewater that will include a wastewater surveillance. So and also we were able to do a economic evaluation or cost benefit or whatever evaluation for this, and so that surveillance system should not be expensive for the government. So it should be at least an investment that is actually be more or less the government will be able to afford. No? So we cannot have we cannot sustain if this is going to be a project based. No, should be a part of the regular budget of the government. That's all. Thank you and congratulations again.
Thank you, sir, for your comments and for your question. Our project now is in phase 1 and it will end in April, but we have a phase 2. So for our next step, well, from the pilot, we had phase 1, and then for our next step, we will expand to 2 more cities, and that's neighboring city, Tagum City and Digo City. That's still in the Davao region. And then also we will increase our sampling points in Davao City. And also we have fixed sampling areas also in the 2 different cities, additional cities. And aside from that, we would also like to explore other diseases or like the tuberculosis and the AMR also for WBE, because as mentioned earlier, WBE is not just exclusive for COVID-19 and it has been used in other diseases. So that's our goal, to expand in terms of sampling site and to expand in terms of the disease that we will monitor. And part also of our extension is, of course, we will continue to do watershed mapping, right? Fem, can you elaborate on that?
Yes, ma'am. Actually, we are trying to establish a workflow or a methodology for establishing watershed maps or generating watershed maps that can be doable in other cities, even if you aren't really that expert of GIS software. So in that scenario, other LGUs or even cities can initially create their watershed maps for WBE studies or projects.
The data analytics part also.
Hello. So for data analytics naman, sir, we'll push to the predictive model, although we are lacking the total variable for the total volume of sewer shed, but we can still use the predictive model and we set that variable as a parameter. Parang magpe-perform kami ng sort of sensitivity analysis to estimate the number of infected individuals. But there's still more analysis na gagawin namin. We have other regression analysis to like regularized regression analysis, where we perform different types of regression analysis, and then parang choose kami ng best fit or best model for predicting the number of infected individuals. Thank you.
If I can also add po, Ma'am Dan, Ma'am Caro.
Okay, go ahead, Ms. Shyrill.
Yes po. For COVID-19 actually po, and for other diseases, no, so since we already saw na magkakabit-kabit po yung magkakabit-kabit po kasi mga barangay wastewater nag-converge sa isang point. So even if we don't do it per barangay, because one barangay is connected to another barangay by a canal or a creek, then we can widen the scope po. Hindi na siya barangay level, but we can widen it to like adjacent barangay, so that we have a bigger population contributing to the sample that we're getting from the creek. So a bigger pool of samples. So if we get signals there, baka po mas malaki ang chance na maka-pick up tayo early, no, ng mga brewing epidemics in the community, because we are looking at a bigger scope now. Hindi lang po kaya na isang city agad kasi masyado po malaki ang unit na yon, but we can do adjacent barangays, or we can also do WBE or wastewater surveillance in specific strategic places like public transport, yung mga bus station, yung mga airports or ports, seaports. Yun din po, pwede din doon tayo mag-focus ng ating surveillance for introduced, no, or introduced or emerging na mga infectious diseases. Basta po meron na tayong specific na mga targets, I think we can adapt to that. And in terms of sewershed mapping po, we also plan to aside from the paper that we're doing, no, so it's maybe if we can involve more people by making the protocol easier, we can actually do a little bit of citizen science, for example, kasi we can collect information about creeks, for example, kasi marami pong creeks na hindi pa nalalagay sa mapa, so we can start with that and engage students or college or high school students who can also help in that. And then si iWas or si phase 2 ng iWas can maybe do something like train them on how to use the data, or we can analyze the data, but we just need more people to be able to give us more points, kasi po yun ang nagpapatagal kapag kami mismo ang magti-trace, and malaki na po ang scope natin kasi hindi na lang siya isang barangay. But I think those strategies are available and it's easy to teach na lang po ngayon sa format ng technology, no? Tsaka po, teching ngayon ng mga bata, mas magaling pa sa atin ng mga adults. So I think we can tap in that, parang special na characteristics itong younger generation, so that we can also make sewershed mapping activities faster po para maka-generate tayo ng mas maraming maps. So yun po. Thank you po.
Yeah, I'd like to add that we've seen the success of this in Davao. So now it's time to spread it out. I'd like to apply it to Quezon City as well. So there's one thing that's good here is that we've got many universities and schools that we can all work together collaboratively. And we've got wastewater treatment plants like Maynilad and Manila Water that we can also try to work with. And we will be needing support from the local government and from all the schools. You've asked about how we can incorporate this big work on sewershed mapping. Sewershed is, watershed. We have that term for so long, natural watershed, but now that everything seems to be engineered and built up, so we need to understand our sewershed system. So we could probably do the training, embed it in some of the courses in these universities, or probably as an OJT activity within the city planning division. So there are many ways we could go about it. And what's nice is that we already have these universities here, as here in UP Diliman, UP Manila, across the street, Ateneo, and it's a big work. We can all work in our small areas because it's very different from one to the other, and there's a lot of work. The frequency of sampling is a lot, so it requires a lot of people. So just working together collaboratively can really move us forward. Thank you.
And Ma'am Cara, if I can add one more thing po. Actually, in the initial design of the iWas, we were part of the deliverables is to train or to get in touch with COVID labs who already have been testing COVID, no, for clinical samples. Since the workflow is very similar, except the concentration part and the sample collection part, no, kasi sa wastewater ka nakukuha. So that's actually we're planning to complete the SOPs for those, so that we can maybe in the future, no, maybe COVID labs, so are many na po ang COVID labs natin in the hospitals, no, in LGUs, maraming COVID labs. Maybe they can be our partners also to help us surveil, no, for emerging infectious diseases that can be detected in wastewater. So I think that's also one direction that we can take. We have plans for that, but we have not really gotten to do it yet kasi po nasa pandemic pa rin tayo, meron pa rin nagtitest, no, sa COVID labs. But I think kapag hindi na talaga siya masyadong emergency, then maybe we can explore connections with them. That's why we also plan to go out of Davao City na po and to the cities like Tagum and Digos, no. and also work with their COVID labs. Kung hindi man po kayang gawin ng COVID labs doon, then UPMIN can be like a central hub where you just submit your samples, similar to what other countries are doing, no? Kasi po nasa forefront ng wastewater surveillance sa ibang countries are universities with equipped laboratories. Aside from the health agencies po nila, partnered sila ang academe. So that can be also set up in the academe in different cities in the country. Pwede pong magkaroon tayo ng mga hub na regional or citywide. Or we can also tap the COVID laboratories that are already doing COVID testing, kasi konti na lang din po ang change natin to be able to give the same data, no, on COVID-19, on SARS-CoV-2 viral titers from wastewater. So I think, kasi po I've said earlier, yung barrier naman po sa technology, because it's very similar, konti na lang po yung ituturo natin talaga. So I think that's one way to also expand our reach by tapping other laboratories who are already doing it sa COVID labs, or building hubs, regional hubs for that. Thank you po.
If there are no other questions, thank you very much. It's been very interactive, especially the Q&A portion. Thank you so much for our guests, and we really do reach out to us, email us, let us know your interest. This work is not just for one group, it's for a lot of groups. It's collaborative.